Hello, everyone, and thank you for joining us for today's webinar, COVID-19 Response Measures Update, webinar for families and caregivers. I'm Tiffany Fearon, and I'm the Policy Manager at Family Councils Ontario. Thank you so much for joining us this morning. I'd like to kick this webinar off with a brief land acknowledgement to recognize that our daily practices take place on traditional Indigenous territories across the province. We acknowledge that there are 46 treaties and other agreements that cover the territory now called Ontario. We thank the first caretakers and inhabitants and seek to continuously recognize the deep history, land rights, and experiences of First Nations, Métis, and Inuit people. It is truly our duty to continue on the path of learning about Indigenous history, culture, and contemporary issues, and of course, find meaningful ways to advance truth and reconciliation. Before we jump into this important topic and webinar, I wanted to go over a few housekeeping and logistics items. Before we turn things over to our guest speakers, you'll notice that all participants are in listen-only mode. We have protected time today for a question and answer period. We thank all participants that submitted questions alongside their registration. All of those questions have been compiled to be addressed by our guest speakers at the end of the presentation. Our priority will be to respond to those questions, but we will also try to answer as many live questions as possible. At that time, we invite you to use a question and answer box to pose your questions to our guest speakers and upvote questions of interest to you. Please use the chat feature only if you have technical issues to communicate with me. If you require translation, please use the captions function at the bottom of your Zoom window to enable closed captioning in the language of your choice. Today's session will also be recorded and made available to participants following our time together on both the Family Councils Ontario website and our YouTube channel. Now, it's my pleasure to turn it over to today's first speaker from the Ministry of Long-Term Care, Anne-Marie. Thank you, Anne-Marie.
Thank you, Tiffany. Good morning, everyone. Thank you, everyone, for taking the time to join today's webinar to learn more about the updates to the COVID-19 response measures for long-term care homes. My name is Anne-Marie Carnelli, and I am a manager in the Service System Planning and Operational Issues branch in the Operations Division of the Ministry of Long-Term Care. I'm joined today by other colleagues on my team, across our division, and with the Ministry of Health. Before we get started, I would like to first acknowledge how challenging it has been these last couple of years, and I want to thank all of you for your ongoing efforts, which have been critical for keeping residents safe while ensuring high quality of care within long-term care homes. For today's agenda, an overview of the Ministry of Long-Term Care's recent guidance changes will be provided by my colleague, Erin Mannix. That will be followed by a question and answer period. Following today's webinar, we intend to share the presentation material in English and French on longtermcarehomes.net. Should you wish to follow along with today's presentation in French, please email mltcpandemicresponse@ontario.ca, and we will provide you with a copy of the presentation in French. So in terms of context for today's session, updates reflect the ministry's ongoing work with the Office of the Chief Medical Officer of Health to monitor the status of the pandemic, and we are now taking the next step in the phased approach to embedding COVID-19 response measures into routine operations, including new changes to masking, IPAC audit frequency, and isolation requirements. The Ministry of Health has also made updates to their case management guidance for staff, residents, and visitors who have COVID-19, which will be outlined. These changes are to be implemented by June 30th. However, homes that were prepared to make these changes in advance of this date, were welcome to implement changes as early as June 26, 2023. Long-term care homes should anticipate that some pandemic response measures may be reinstated if the province enters a high-risk period of respiratory virus transmission, such as during the fall respiratory virus season. This is something that we will continue to monitor, and of course, will communicate with homes if there are any changes. I will now pass it over to Erin Mannix from my team to provide an overview of the recent changes.
Good morning, everybody. So just to start off today, in regards to masking, the changes applicable here are for caregivers and visitors. Masks are now recommended, but not required in all areas of the home. This means that caregivers and visitors may now join in for dining and sharing a meal or a beverage with their loved ones in communal areas. For staff, students, volunteers, and support workers, masks are required based on a point of care risk assessment, consistent with the existing routine practices and on the return to work protocol following a COVID-19 infection. What this means is that an individual will assess the risk of exposing themselves or others to an infection. Staff may consider wearing a mask during direct prolonged care. So this is defined as one-on-one care within 2 meters of an individual for 15 minutes or longer. Also for staff, students, volunteers, and support workers, masks are required based on the return to work protocol following COVID-19 infection. So this is when staff with COVID-19 may now return to work once their symptoms have been improving for 24 hours, 48 hours if their symptoms are gastrointestinal and they have no fever. Staff should follow measures to reduce the risk of transmission for 10 days from their symptom onset or positive test, including wearing a mask and distancing from others before they remove their mask. Masks are no longer required in administrative and staff-only areas, for example, lunchrooms, staff offices, or gym. And long-term care homes are encouraged to implement mask-friendly policies, including accommodating staff who may prefer to continue to wear a mask beyond minimum requirements, or residents and substitute decision makers who request that a staff member wear a mask when providing care in alignment with the resident's Bill of Rights. For residents with COVID-19, what's new? Residents with COVID-19 remain under isolation and under additional precautions for 10 days. However, if the resident is able to independently and consistently wear a mask, residents may leave their room provided it has been 5 days from symptom onset and positive test, and that their symptoms have been improving for 24 hours and they remain masked at all times outside of their room. If the resident is unable to mask, then they remain in isolation until day 10. If residents are able to leave their room for walks in the immediate area with a staff person wearing appropriate personal protective equipment to support their overall physical and mental well-being. For visitors and caregivers with COVID-19, non-essential visits to high-risk settings or to individuals at higher risk of severe outcomes should still be avoided. That includes long-term care homes and long-term care residents. However, if a visitor is essential to a resident's overall health and well-being, such as a caregiver, they are able to visit within the 10-day time frame if their symptoms have resolved, but they must follow additional precautions for 10 days, including wearing a mask. So what measures are currently in place? These measures continue to protect and optimize the health and safety of residents, visitors, and staff. Masking being based on a point of care risk assessment, and that visitors and caregivers are recommended but not required to wear masks. Passive screening or the self-monitoring of symptoms is still required. daily symptom monitoring of residents to detect the presence of infection, routine infection prevention and control practices, for example, hand hygiene, environmental cleaning, and ventilation. And lastly, the access and availability of COVID-19 vaccines and therapeutics. These measures are the measures that are in effect when a home is not in outbreak. What COVID measures are no longer in effect? So these measures are the measures that no longer apply. It is important to note that some of these measures may be needed again in the future if there is a high risk to a resident and/or staff health and safety in long-term care homes. But for the time being, there is no universal masking, no physical distancing or cohorting, no visitor restrictions, no asymptomatic screen testing for staff and visitors, no active screening for residents and visitors, and no absence restrictions. And just a reminder, that is when homes are not in outbreak. So we are going to move over to the question and answer period. And as a reminder, that email on the screen, you can reach out to us if you have further questions.
Great. Thank you, Erin. So I think we can move right into the questions that were pre-submitted prior to today's session. And thank you again for submitting your questions. So maybe we can start with the first question. What is the plan to ensure my 96-year-old vulnerable mom is protected from careless staff or visitors who don't self-monitor?
So all staff are required to follow the Ministry of Health's COVID-19 guidance for long-term care homes, retirement homes, and other congregate settings for public health units, which requires them to self-isolate and get tested if they have COVID-19 symptoms. Visitors and caregivers should not enter the home if they are experiencing symptoms of COVID-19 or have tested positive. So residents or substitute decision makers and caregivers can request that a staff member wear a mask when providing care.
Thank you, Erin. So the next question. Why were vaccinations, a second bivalent, not given in long-term care homes in the spring of 2023? Rena?
Yeah, so individuals were provided with a spring vaccine. So individuals at an increased risk of severe illness to COVID-19, including residents who were in long-term care homes, were recommended in April of this year. It was around April the 4th to 6th to receive a bivalent vaccine this spring, provided 6 months had passed since their last vaccine dose or confirmed COVID-19 infection. It is anticipated that there will be a fall booster vaccine recommendation for long-term care residents ahead of the fall respiratory season. However, we are waiting the recommendation from public health to confirm this.
Thank you, Rena. So the next question, why are there still mask limitations indoors, and why only on occasion can we provide snacks? Only residents can eat the rest. The rest of us must wear masks. Sorry about that. Erin.
So caregivers and visitors with these changes may now join in sharing a meal with their loved ones in communal dining areas. Infection prevention and control practices such as hand hygiene should continue to be followed in communal dining settings, and masks are recommended but not required for caregivers and visitors. That's just a reminder.
Thank you, Erin. So the next question, there are still outbreaks. A large number of residents share rooms, yet there are no shared rooms or IPAC protocols? Has this changed? So maybe Erin or Lara. And I see that we have some of our IPAC program folks on the line as well. Erin, maybe you can take that.
Yeah, absolutely, I can. Sorry. Can you, okay. It was taking a minute to get me off mute.
Or Lara, sorry, one of you. I'm not sure if Lara.
Yes, I'm so
wonderful.
sorry, everyone. I'm having some computer issues today, so I'm slow to answer. But so yes, nothing has changed in terms of IPAC protocols for shared rooms. In the Ministry of Health guidance, we do have some language that suggests that if somebody is symptomatic or that if a resident needs to be isolating, that the home try to put them in a single room as much as possible, just to limit exposure to other people, and to definitely try not to have that person in a 3 or 4 person room. So ideally, it would be a single room or a room with one roommate only. Of course, this is limited by the home's physical infrastructure, but that is what we recommend in our guidance.
Great, thanks, Lara. So the next question, are residents on a floor with an outbreak allowed to go outside for daily walks and fresh air? Isolation can be so harmful. Erin.
So when in an outbreak, homes must always follow the direction of the local public health unit. And as I had mentioned in the presentation, if a resident is symptomatic or has tested positive and is able to consistently wear a mask, they may leave their room where feasible when accompanied by a staff person wearing the appropriate personal protective equipment for a walk, if it has been a minimum of 5 days from symptom onset or positive test. Or if they are asymptomatic or their symptoms have been improving for 24 hours and no fever is present. The resident is not to join communal activities where they would need to remove their mask. Group activities and communal dining should be conducted such that the outbreak unit is cohorted separately from unexposed individuals, and group activities and communal dining for cohorts may resume. Wherever possible, continuing group activities for exposed cohorts is recommended to support resident mental health and well-being. If a resident is not required to isolate and lives on the outbreak floor and is symptom-free, they are able to leave that floor.
Great, thanks, Erin. So the next question, why is it recommended that visitors and caregivers wear masks while staff, students, and volunteers do not? What is the rationale? Erin?
So masks are required based on a point of care risk assessment. That point of care risk assessment must be completed by every healthcare worker before every resident interaction and task to determine whether there is a risk to the health of the staff or others being exposed to an infectious agent, including COVID-19, and determine whether the appropriate personal protective equipment is required. So if that staff person doesn't have the knowledge, skill, or training to perform this assessment, it should be completed by a supervising staff member that does. And staff may also consider wearing a mask during prolonged direct resident care, defined as one-on-one care within 2 meters of an individual for 15 minutes or longer. For caregivers and visitors, masks are recommended but not required in all areas of the home.
Great, thanks, Erin. We'll take the next question. So there's continuing concern about outbreaks in homes. We are also concerned for us, the senior caregivers who visit long-term care homes. Erin?
So, sorry, I just lost the question, Anne-Marie. Do you mind just reminding me?
Sure.
Repeating the question, please.
So there is continuing concern about outbreaks in homes. We are also concerned for us, the senior caregivers who visit long-term care homes.
Yeah, so residents and caregivers do have the right to request that staff wear a mask when providing care. As a reminder, as I previously mentioned, masks are recommended but not required for caregivers or for visitors. And those infection prevention and control practices continue to be in place as part of the daily routines, such as environmental cleaning, good hand hygiene practices, access to personal protective equipment, and procedures to manage and reduce the spread of infection. We will also continue to monitor the situation with the Office of the Chief Medical Officer of Health. And as I mentioned, should they be needed at a time when risks are more severe, measures may be reintroduced at that time.
Great, thanks, Erin. So the next question, I understand that masking requirements have changed. What can you do if a home refuses to change the masking requirements? Erin?
So the ministry's requirements here are the minimum requirements set out for homes. Homes can implement their own masking policies that go above and beyond the ministry's minimum requirements. However, if they do so, homes should engage the Residents' Council, Family Council, and the local public health unit to inform their policies, review their policies regularly, and ensure that they are supported by the most current clinical evidence and seek independent legal advice as needed.
Great, thank you. So the next question, do staff have to social distance in staff rooms for eating?
So
Erin?
there are currently no COVID-19 specific measures or restrictions related to physical distancing or cohorting when not in outbreak. Staff who are returning to work under that return to work protocol should practice physical distancing post-infection for those 10 days as part of the additional precautions post-COVID-19 infection.
Thank you. So the next question, the changes hinge on staff, let me start again here. The changes hinge on staff making judgment decisions and honesty. How will compliance and resident safety be ensured?
So masking for staff is required based on a point of care risk assessment. And as I had mentioned with that, so per the COVID-19 guidance, there is a personal protective equipment for healthcare workers and healthcare entities document that homes can use to support this. And the PCRA, or the point of care risk assessment, must be completed by every healthcare worker before each patient interaction and task to determine the level of risk to the healthcare worker or other individuals being exposed to an infectious agent. And then they make the assessment and determine the appropriate infection prevention and control measures to be taken. So these assessments are part of routine practices, and healthcare workers are expected to be familiar with this process. As I had mentioned previously, if the healthcare worker, regulated or unregulated, does not have the knowledge, skill, and training to perform this assessment, it should be performed by a supervising healthcare worker that does. In some circumstances and settings, it could be helpful to achieve this by putting signage in the patient room, indicating the level of precautions needed as determined by the infection prevention and control lead of the setting. These infection prevention and control practices are something that the ministry inspects at every inspection, and residents and substitute decision makers can request that staff continue to wear masks during direct care. And lastly, a reminder that staff are not to attend work when sick or following their COVID-19 infection. And if they do, based on the protocol for return to work, they are required to wear a mask for that time frame.
Thanks, Erin. So the next question, please give the rationale for these changes. Ontario's population is at less than 60% for over 2 vaccinations. Rena?
Yes, so due to the effectiveness of vaccines, high level of community immunity resistance, and improved diagnostics and treatments, the World Health Organization, the WHO, has said that COVID no longer constitutes a global public health emergency, and Ontario is equipped with the tools to protect itself. So given that Ontario is currently is not in a high risk period for respiratory virus transmission, and considering the low to moderate COVID-19 activity at this time in the province, the ministry, in collaboration with the Ontario Chief Medical Officer of Health and the Ministry of Seniors and Accessibility, we're moving more towards the next phase approach of easing COVID-19 restrictions and embedding these COVID-19 response measures into a routine practices. So some pandemic response measures may be reinstated if the province enters a high-risk period of respiratory virus transmission. So as Erin had mentioned several times, we're constantly looking and evaluating. These changes bring Ontario into alignment also with other provinces across the country. So Alberta, British Columbia, and Manitoba have already made similar adjustments to their masking policies and are designed to ensure that we remain focused on balancing the health, the mental and emotional well-being of residents of long-term care homes and retirement homes across the province, with the risks associated with COVID-19 and all of the other respiratory illnesses.
Thank you, Rena. Next question. Do we still have to sign in and out of the home when visiting? Erin?
Yeah, so the requirement for long-term care homes to maintain a visitor log is actually found in the regulation. So it's in section 267, subsection 2 of Ontario Regulation 246/22. And this requirement states that the visitor log must include, at a minimum, the name and contact information of the visitor, the time and date of the visit, the purpose of the visit, for example, the name of the resident person is visiting. And these visitor logs are used to assist with communicating to visitors should they have come in to close contact with an infected person while in the home.
Thanks, Erin. Next question. Is the requirement for staff to social distance in the lunchroom still in effect? Erin?
Yeah, so as I had mentioned in the presentation, there are currently no COVID-19 specific measures or restrictions related to physical distancing or cohorting when not an outbreak. As a reminder, staff who are returning to work following their COVID-19 infection should practice distancing post-infection for 10 days. And also as a reminder that these are the minimum requirements set out by the ministry. So some homes may have different policies in regards to this.
Thank you. Next question. Will booster shots still be given? Rena?
Yeah, it is anticipated, as I had previously mentioned, that a fall booster might also be recommended for long-term care residents ahead of this fall's respiratory season. If it is, there will certainly be the interval of the 6 months since the last vaccine dose or confirmation of their COVID-19 infection. So again, we're waiting for public health recommendations to see about the fall booster, and then following the fall booster, we don't have any information at this point in time whether it will become an annual vaccine or if we will continue with the 6-month intervals. So we're awaiting the information.
Thank you, Rena. The next question here is, how effective are vaccines and how prevalent is COVID-19 in the community? Rena?
So the goal of the province is of the provincial COVID-19 immunization program is certainly to protect Ontarians from COVID-19. So we know that vaccines minimize the risk of severe outcomes, including hospitalization and death due to COVID-19, and also may reduce the number of new cases. So getting vaccinated and staying up to date with your COVID vaccines is the best way to remain protected from the most serious effects of COVID-19 infection. The overall risk to Ontarians of COVID-19 has been diminished through factors such as the increased immunity, high vaccination rates, and the availability of antivirals. And as I previously mentioned, we're in a low to a moderate risk of COVID-19 infection right now in the community. So it's low.
Thank you, Rena. Tiffany, if it works for you, I think we can move over to the questions coming through in the Q&A box.
Yes, that would be perfect. Thanks, Anne Marie.
No problem. And thanks to my fabulous colleagues on the line for supporting the Q&A portion. So maybe we can start with the first question that came in through the live chat. What type of mask is required? This has not been specified. So maybe that's something that Lara or...
Sure, I can take a look at that one. So for staff that are returning to work, we advise that they wear a well-fitting surgical medical mask. It is up to them whether they want to wear a fit-tested or not fit-tested N95 or KN95 as well. In terms of, I'm not quite sure what the situation would be, but in most situations we advise to wear a well-fitted medical mask, or if there is a risk of some sort of procedure occurring where there would be like droplets in the air, like aerosol droplets, then the staff member would be advised to wear an N95. This is all based on their point of care risk assessment. Yeah, I'm sorry, I'm fairly limited because I'm not sure in exactly what type of scenario the question would be referring to.
That's great. Thank you, Lara. Maybe we can take the next question here. Why the different guidelines for COVID positive residents versus staff? Is returning to work in 48 hours? Oh, sorry. For example, returning to work in 48 hours, but resident isolation for longer. So I'm wondering if that's something you can handle as well.
I can take this one as well. So in previous guidance, staff were allowed to return to work after 24 or 48 hours, depending on kind of symptoms they were having, based on the home having critical staffing shortages. So the guidance said if the home was really suffering when it came to their human resources, and if this was impacting the care of people, then staff would be allowed to come back to work earlier. So based on this logic, as well as some emerging evidence that shows that relatively healthy middle-aged adults who have received multiple vaccinations may have a period of transmissibility that is a bit shorter than other populations. So based on these two factors, we provided this guidance that staff can return to work a little bit earlier and they don't need to stay home for a full 10 days.
Great, thanks, Lara. Can a long-term care home decide to continue current masking policy? Erin, can I
this
ask
one?
you
Yeah,
to...
Anne Marie. And you know what? It's actually the question after it goes with it as well. There are these are minimum ministry guidelines. Do the homes have the discretion to put in place protocols that meet ministry requirements and higher? So both of these questions kind of go together. And as I had mentioned, these are the minimum requirements set out by the ministry. Homes are able to go above and beyond ministry requirements. However, if they do so, they need to engage the residence council, family council, and local public health unit to inform their policies, review their policies regularly to ensure that they are supported by the most current clinical evidence, and seek independent legal advice as needed.
Can I just jump in on that really briefly? Hi, everyone, Jackie Seaton here. I just want to add that it's really important to note that the IPAC lead in the home has a really significant role in this area. And the any change that they would either wish to keep or any practice that they would wish to keep in place, the IPAC lead and other home leadership and clinicians in the home, any practice that they would wish to either keep in place or if they want to, reinforce their routine practices would be based on the expertise of the IPAC lead and a direct assessment of the circumstances in the home. So they shouldn't be introducing policies purely because they wish to have a certain practice in place. It has to be based on an assessment of the actual risk in the home and the appropriate practices needed for the safety of residents and staff in that home. We haven't talked that much about the role of the IPAC lead, but it's an important piece to mention. And I just wanted to add, there may be instances where, legal advice is not needed. It's really, because this is really about the expertise of the IPAC lead and their, role and ability to make decisions, as well as the leadership in the home for the safety of the residents and staff in that home. Thank you.
Thanks so much, Jackie and Erin. Jackie, maybe I can keep you on the line to help answer the next question, since it does link closely with the IPAC. So a question here is, do long-term care homes still have to provide masks at entry points for visitors should they wish to use them? Are homemade masks okay to wear?
I think I would return to what our colleague from the Office of the Chief Medical Officer of Health was saying in terms of the kinds of masks recommended. And I also just want to reinforce, thank you for the question, by the way. I also wanted to reinforce that there is still PPE available through the provincial stockpile. So, caregivers can receive masks from the licensee as well, if they feel safer and are more comfortable with that. So I would just refer back to the comments about the kind of masks that we're talking about that my colleague Lara had shared. Thank you.
That's great. Thanks, Jackie. Okay, so, and I think we've already answered the question related to, will masks continue to be provided in long-term care homes?
Yeah, I just wanted to jump in there for a minute too, Anne-Marie, just to say we are really encouraging homes to use that portal for their testing supplies and for their PPE. They are free of charge for the homes and will continue for now to be free of charge. So really encourage homes to use that portal and order their PPE supplies from there.
Great, thanks, Rena. So I'm just looking at the next question here. A great many of these protocols are based on the premise of symptoms being present, but we know that there can be people who are asymptomatic yet are infected with COVID and can readily spread the disease. In light of these facts, why has the ministry eliminated daily rapid testing for all staff, caregivers, and visitors? I'm wondering, Lara, if you're able to tackle this, or sorry, Jackie.
Thank you very much. Lara, if you want to get started, I'm happy to supplement this as well.
Sure, thank you. So from the perspective of the Office of the Chief Medical Officer of Health, I don't believe that currently we are recommending that anyone get tested if they're not showing symptoms. So, and even in our guidance, I believe we revised the language to say that anybody that has symptoms may get tested, so it's no longer a requirement. But that is the perspective of the Ministry of Health.
Great, thank you. So the next question here, who do we contact if we have concerns about the guidelines that the long-term care home is instituting when coordinators cannot answer? Long-term care, community, public health, could you list the contact information? Yes, we can definitely provide. We have our MLTC pandemic response inbox, so we have that available. We can also follow up following this session with additional contacts, or feel free to, I believe there's Tiffany, I believe there's an inbox email account for FCO that folks can email you related to, or sharing any specific details to make sure that we're providing them with the right contact.
Correct. They can send any emails to info@fco.ngo.
Great, thank you so much. And we'll make sure the right contact is provided in response to the question. Can we have further clarification why caregivers and visitors are recommended to wear masks and why the difference with staff, students, and volunteers? I'm wondering if this is something Lara that, or sorry, Erin or Lara, that you're able to handle.
I think, Erin, I think you might have answered this a little bit earlier, but I think one thing that we didn't discuss is that I guess this is an assumption, but caregivers and visitors, we would assume that when they're visiting a family member that they would be, in close quarters with them, so likely within 2 meters, and would likely be sitting with them or spending time with them for more than 15 minutes at a time, which is exactly the recommendation that we're giving to staff when they're providing prolonged direct care. But I think Erin might have touched on a few other points earlier as well.
Yeah, thank you, Laura, for covering that. I don't have much to add beyond that. The only other thing I wanted to circle back on was the concerns and complaints. The other piece that is available to individuals is the long-term care home action line. So if there is an urgent complaint, these include cases of harm, neglect, or danger to residents, but also non-urgent complaints. So less serious complaints related to diet, activities, or care. There is a phone number for the long-term care family support and action line, and that is 1-866-434-0144. We can also repeat that or send that to you if you reach out to us by email, and they are open from 8:30 a.m. to 7 p.m. 7 days a week.
That's great. Thank you so much, Erin, for that useful information. I think, and to my colleagues on the line for your support through the Q&A period. Tiffany, maybe I can turn it over to you. I think we don't have any other questions in the chat, so maybe I can turn it back to you. And thanks again, everyone, for all of your awesome questions. And again, we will provide our contact information up on the screen, and at the end of the call for those that would still like to get in touch with any additional questions, comments, or concerns. So thank you.
Perfect. Thank you so much, Anne-Marie. I'm actually quite surprised that we've gone through all of the great questions, and thanks again to everyone that pre-submitted questions. If there are any more, because we still have a good chunk of time, I did see a few raised hands, but I do encourage all participants to use the Q&A function in case you do have any questions that you'd like to ask the amazing team from the ministry here with us today. Again, another reminder, if anyone has any other questions, please do type them into the box at this time. And I'll just make a quick reminder for the French caption. So if anyone is looking for French closed captioning for this webinar, we have enabled French captions, but you can also utilize the translation functions at the bottom of your Zoom dialog box. So you should be able to choose the option of a different language of your choice if you'd like the translation to come through that way. You can also click the bottom button that shows interpretation. So please do utilize these functions. Also, you can reach out to the Ministry of Long-Term Care team on the line today by email, and you can do so in both English and French. And the email that they provided, that if you do have any additional questions that come to mind after this webinar, you can send all of those questions or any commentary to MLTC pandemicresponse@ontario.ca. Okay, so I think during my reminder, we did receive a couple questions. So yes, the PowerPoint slide deck will be provided, and there will be additional information on how you can access the recording after. So please stay tuned to our e-bulletin, as well as any follow-up emails from Family Councils Ontario on how you can access this information again. Okay, I do see a raised hand. Unfortunately, we can't answer raised hands with this function at this time. I do see that we have a few phone call-in listeners. If you do want to reach out directly to Family Councils Ontario or the Pandemic Response Team, you can do so with the emails provided throughout the presentation. Okay, Emery, I do see that we do have another question, so I think I can throw it over to you. Would you like me to read it quickly, or I think it might have come up for you as well?
Thanks, Tiffany. It's a great question. So the question, I'm not some of these, I'm not sure if we have the program experts on the line with us today for some of these questions. So maybe I can ask my colleague, but these two questions I think that we just recently received, we may have to take back and circle back with these individuals or through your office, Tiffany. But I know one question here is, we have many, excuse me, we have many metrics to gauge residents' physical health. For example, PCR tests, vitals. Is the ministry planning on coming up with a metric that would measure residents' mental health? And the second question, why did you fail to mention increasing both vitamin C and D and increase natural immunity? I think these are both questions we can take back and circle back with the individuals, unless there's folks on the line that are able to answer them. But I don't think we have the program experts on the line with us today. So we'll commit to circling back on those two questions, Tiffany.
Okay, perfect. Thank you so much, Anne-Marie. If there aren't any more questions from our attendees today, we did have a really great group on the line, and we do thank you for taking the time out of your busy schedule, especially after a long weekend, to attend and learn about these really important new updates. So again, as I mentioned, we do have our inbox open. If you do have any family councils related questions, please do reach out to the Family Councils Ontario team at the info@fco.ngo email, and we'll be sure to follow up with the best information and resources that we can. And again, any questions to Anne-Marie and her team can be sent and shared to the MLTC Pandemic Response at Ontario.ca mailbox. We'd really like to thank everyone for attending. It is being recorded, and you can watch this again when it is made available. So please stay tuned to our e-bulletin for the information. Also, we do share many relevant ministry related news as well as updates. So feel free to subscribe to our e-bulletin for additional information and to keep abreast of the latest updates. So thank you so much to everyone for attending. If there is any additional questions, I do see another one. I might have to put us back on the spot, Anne-Marie, just for a reminder for essential caregivers. I do see a question asking, is there a need to still show proof of vaccines for essential caregivers?
Thanks, Tiffany. Maybe I can ask Erin, she just popped on the line. Thank you.
Yeah, I can take this one. So at this time, there's no ministry requirement for proof of vaccination policies. And similar to masking or asymptomatic screen testing, homes are able to go above and beyond ministry requirements and implement their own policies that may require this. But as I mentioned, they must do so with consideration to the Residents' Bill of Rights, with the Residents' Council and the Family Council. So yeah, as I said, at this time, there's no ministry requirement, but a home may have that requirement.
Thanks, Erin. Thanks, Tiffany.
Thank you so much. So I think we've reached maybe the conclusion of this webinar. Again, if there are any additional questions, please reach out to the Family Councils Ontario team, as well as the Ministry Pandemic Response team. Please look out for these additional materials and make sure to get in touch if you do have any comments, complaints, or questions to share with us. So thank you so much to Anne-Marie and to the great team at the ministry for doing all of this work and making sure that our residents, families, and staff feel equipped and safe and prepared for anything that might come. So thank you so much for joining us today. And if that's all for today, Anne-Marie, if there's any last words from you before we wrap up.
Sorry, I just lost my video there. No, thank you so much, Tiffany, and thanks to everybody for having us today. It's been a pleasure, and thank you for all of your great questions, and thanks again for your time, and I hope you all have a great rest of the day.
Perfect. Thanks so much. Take care, everyone, and stay safe.